Antimicrobial prophylaxis. Clinical scenario. Malaria prophylaxis for travelers. Recommended medications. Atovaquone, mefloquine, doxycycline, primaquine, or chloroquine. Note: choice of drug depends on the region's resistance patterns. Question 1. A 30-year-old man is planning a 2-week trip to a rural area of sub-Saharan Africa where Plasmodium falciparum is known to be chloroquine resistant. He has no known drug allergies. What is the most appropriate malaria prophylactic regimen? A. Chloroquine. B. Doxycycline. C. Primaquine. D. Metronidazole. E. Trimethoprim sulfamethoxazole. Correct answer, B. Doxycycline. Explanation. In areas with chloroquine-resistant Plasmodium falciparum, such as sub-Saharan Africa, doxycycline is one of the recommended options for prophylaxis. It should be started 1 to 2 days before travel and continued daily during the trip and for 4 weeks after returning. Why not the others? A. Chloroquine, ineffective due to widespread resistance in this region. C. Primaquine, used for prevention of P. vivax and P. ovale relapses, not first line for P. falciparum. D. Metronidazole, not used for malaria. E. Trimethoprim sulfamethoxazole, not effective against malaria parasites. Question 2. A 26-year-old woman is planning to travel to India for 2 months. She has a history of generalized anxiety disorder and currently takes sertraline. Which malaria prophylactic medication should be avoided due to risk of worsening psychiatric symptoms? A. Mefloquine. B. Atovaquone. C. Chloroquine. D. Doxycycline. E. Primaquine. Correct answer, A. Mefloquine. Explanation. Mefloquine is associated with neuropsychiatric side effects, including anxiety, depression, hallucinations, and suicidal thoughts. It should be avoided in patients with a history of psychiatric disorders. Why not the others? B. Atovaquone, well tolerated with fewer psychiatric side effects. C. Chloroquine, can be used if there is no regional resistance and no contraindication. D. Doxycycline, does not worsen psychiatric symptoms, but can cause photosensitivity. E. Primaquine, used for terminal prophylaxis of P. vivax and P. ovale, psychiatric effects are not a primary concern.